question was, when does PRP come into play? So PRP works because basically what you're doing is you're taking growth factors. The growth factors are released in the inflammatory phase, and they stimulate the fibroblasts to come lay down scar tissue. And so all you're doing with PRP is you're concentrating those growth factors to where you might have 10 times the normal level of growth factors, and you inject it into the joint. So you essentially bypass all the problems with the inflammatory phase, because it doesn't have any cytokines in it, it doesn't increase the acidity of the joint, the phagocytes don't come in. You take those growth factors and you create a super repair response that doesn't stimulate massive scar tissue. It just alters the strength or the quality of the scar tissue. So, and it's just like doing steroids. If you do steroids and you don't exercise, you're not going to get big muscles. But if you add the steroids plus the exercise, now you can exercise twice as hard, twice as much, and you're going to get a massive muscle response. And that's what the PRP does. And it actually works in it's attracted to inflammation. So what we would do is we would inject the joints right next to the joints. So you don't actually try and penetrate the facet joints. That'd be a really hard needle hit. You just inject into the paraspinals right next to it. It permeates into the area. The whole area gets a big blast of these growth factors, and it's going to augment what you do. So you can't just inject somebody and walk away, which actually you can, because like I did that to my mom. She had a bad hip. We injected her with PRP. I didn't do any rehab on her because she lives in Tillamook, but she self-rehabs when she walks around because her hip feels better, she can move better, she can do more, she plays with it a little bit, and all the stiff achiness that was in her joint disappeared, and she goes, man, my hip feels great. But if we do it with the therapy, you're just gonna get better, faster results. And we use it on complicated cases. So if someone came in with a lot of arthritis, and I know this is gonna be a hard case, we just did it on an auto accident guy. The guy had massive arthritis in his back. He had a facet syndrome, so traction didn't work. Traction doesn't work on facet syndromes. You have to rest them. Adjustments don't work on facet syndromes. So we just did a PRP injection because he had all this chronic pain plus the fresh new pain from the accident, and it improved his outcome by 20 or 30%. So it was really